grateful to be here tonight. I see a lot of familiar faces, so hopefully that means that you think that you're going to agree with me on some of the things I say. Or if you're ready to go to battle, we'll try to be fair, okay? So, as Brian was saying, I'm a family physician, and I do not have a degree in theology. I don't have, I didn't enter the seminary for a number of years, as some of the people out there had, and people have even completed. So my expertise is medicine, and I was trained here in the United States, and that's where I practice. This is my 20th year, if you count my 3 years of residency. Some of my colleagues are going, wait a minute, that doesn't sound right. So, but it's a nice round number. Right? Always sticks better. I practiced, and this is for physicians in particular, I practiced in private practice for most of my practice. And some of that, as I was talking to someone before who's a physician, retired, that actually was definitely influenced by the fact that I could see that there were things in my practice that I would be expected of doing at like a university or maybe in a certain type of a healthcare system where they might have a problem with me not doing certain things that would be considered the normal way to do things as a physician. I think the obvious things are like abortion, referring for abortions, directly referring for abortions. And then also, as I went through medical school, I ran into situations where, because of my family and just my own understanding of who I was as a Catholic, I realized, wow, I can't do this. I don't think I can do this as a physician. So some of my interest in bioethics is very practical. I want to make sure that I'm doing the right thing by the Lord and that I don't have any regrets. Fortunately, there's a lot of people ahead of me that I could talk to. One of my biggest inspirations, very early in my career, I went to Michigan State for undergraduate. Let's see here. I got to follow my notes. It was a doctor who still practices in Ann Arbor, Dr. Philip Fleming. And I ran into him at Christ the King Parish that I attended when I was in Michigan Medical School. And he's an energetic guy. I had just gotten the prize dermatology rotation. It's a 1 month as a fourth-year medical student. And I was pretty excited about it. And I don't remember how it happened, but the right thing happened. Somehow I thought maybe I can spend a month with Dr. Phil Fleming and do obstetrics with him for a month. Would that be okay? So I talked to the administration and they said, yeah, that's fine. And so when I spent time with him, I was not interested at all in delivering babies. It wasn't like I was against it. I just didn't really think that was going to be part of my regular practice. Not many family physicians deliver babies. I have ever since I've started. And he showed me by being an NFP-only physician how the NFP was the good news of NFP. And he would inspire people, and he had a very pleasant way of talking to people about it. And if people were there only for birth control or permanent sterilization or things like that, he generally left them feeling okay. He respected them. He was able to counsel them. And I thought, well, maybe I should do that. And then when I was in residency at Sparrow, we had a certain setup where we would deliver babies every third night. We'd spend all day there and night. And if we happen to have some deliveries come in, then then you'd do them. And 2 nights would go by and nobody'd have a baby, and then I'd come on and I'd get 3 deliveries. And so I was like, okay, I get the point. You want me to keep doing this? Okay. So it's been a big part of my practice over the years is being a physician. And then people started to come and see me who valued that they weren't going to be asked at the end of their pregnancy, is this your last kid? How are we going to make sure that doesn't happen anymore? So for those of you that are patients know a little more what I'm talking about. But that was a big concern, was could I practice medicine? So I took my family medicine residency requirements, and in it said that I had to offer as a board certified board. We have all these terminology, but I'm a board certified family physician. Had offer family planning services. I said, I can do that. I just will offer ones that are consistent with the teaching of the Catholic Church. which were most clarified with Humani Vitae almost 50 years ago in 1968. I think it was July 25th. So, but the interest in that and the clarity on that came really through people ahead of me. My parents, following the church teaching, Phil Fleming. I think my parents, there's a lot of amazing stories how the Lord brought natural family planning to the Lansing Diocese. So a lot of things, we have little to do with things. We just have to accept, listen, and obey, and be a little bit courageous at times. I also think my partners, when I went to interview, I ran into a couple that had their own private practice, Dr. David Hoisington and his wife Kathy, and they had Dr. Batul Mir was there. And we interviewed, and I wasn't trying to hang myself by my own Catholic ethics here, So I remember I interviewed, and we're getting down to the signing of the papers, and I wanted to make sure I could do what I thought was best and not, get in trouble. And so I said, well, there's some things that, as a Christian, they're Nazarene Christians, that I'm never planning on doing, And he goes, oh yeah, I understand. And I said, so for sure, I would never refer somebody directly for an abortion. Oh yes, absolutely, we wouldn't do that. I said something else, and then I got to the birth control pill, and I said, well, yeah, and I don't really see how I can follow the ethical and religious directives of the bishops, my teaching, and prescribe the birth control pill for contraception. And he didn't even hesitate. He said, and people that work with me, they need to follow their conscience. He goes, I would never ask you to violate your conscience. So it was an answer to a lot of prayers, that I could find a position where I could follow the church teaching. And so that's a little bit about my background. I found that something, I'll hold it up. This is a really nice thing to look at from a distance, You can get this. I'll show it to you later. But if you're in healthcare and you're Catholic and you want to make sure that you're aware of what you should or shouldn't be doing, and you have any questions, obviously you can talk to somebody. But this has been very faithful and very good for many, many years. I gave a talk on this 15 years ago. It still is like a Bible for me. But it's an ethical religious directives for Catholic health care services from the U.S. Conference of Catholic Bishops. So Brian, I'm sure, can give you a link. But you might look in there if you find things that you have questions about. This is a summation of a lot of things that I'm going to kind of touch on tonight. Oh, I got to tell you a joke, though. I mean, these things can be such a drag. So the first joke I heard from a priest in our diocese before he was a priest. He was such a good, people might know that Father Joe Krupp was a stand-up comedian at one point in his life. I didn't go to those, but I went to a Montrose retreat where we all got prayed with for the Holy Spirit. And he got up in his cowboy boots and he said these 3 clean jokes. I think I can do 2 of them. So I need some help on this one. He says, okay, so I was working the other day in a juice factory, and I got fired. And so you have to say something. I just couldn't concentrate. I'm doing better now. So I went back and got another job. This time I went up. You guys like Kogel's? You like Kogel's products? My cousins worked there for years up in Flint. So I went and got a job there in a meat grinding factory, but then I got fired. I kept backing up into the meat grinder and getting a little behind in my work. If you ever hang out with doctors, we got a lot more than that. So. And then I got to tell you what my kid told me today on the way to basketball, or yesterday on the way to basketball. He said, Dad, he was really cold, why did the boy go into the corner of the room? Because it's always 90 degrees. He's homeschooled, forgive him. A couple other things about what's going on with me, and then we'll move on. All right. So the bulk of my training and interest in the Catholic bioethics in a formal sense, in a theological kind of sense, was the diocese formed a natural family planning committee many years ago, which then kind of dissolved, and then it's being reconstituted as a committee now. But they were very kind and sent me and a couple priests to Boston to the NCBC, it's called National Conference for Bioethics Center in Boston in 2002, which I'd never been to Boston. And it was just excellent. And so a lot of my materials are from their handbook that I had a 2-day course there. And then I've updated with the things, and you can actually solicit questions from them online. You can go to their website. If you have an ethical dilemma, they're set up to assist people to clarify modern issues. And then we did an ethics conference, I said, in 2003. I continue to be involved in Couple-to-Couple League, which is a natural family planning method here in the diocese as a promoter. I've been a member of the Catholic Medical Association. If you didn't know there was one, there's a national one, and there's also a Lansing Guild. And so I'd encourage you to look into that if you're interested in, if you're a Catholic healthcare worker. They do a Rose Mass with the bishop every year, and it's an excellent event. It's very inspiring. I can't always attend. And then I'm a member of the St. Peter Parish in Eaton Rapids, all right, way out there. I love that rural parish. And I've also been, I would be remiss not to mention that I've been a member of a charismatic prayer community ever since I was probably 2, I think. Is that right, Mom and Dad? They're out there. Don't you love it when your parents come? Called the Work of Christ Community. And that's also been a source of inspiration for me to live my faith in a vibrant way and to trust in the Lord that He has a solution. So one of the big principles for all ethics, especially medical ethics, scientific ethics, is, is that faith will not contradict, the truth will never contradict truth, okay? So scientific truth is unable to contradict the revealed truth, and I really believe that. And it's one of my first things, and the church promotes that. So there are many people that may have found problems with the church's teaching, and they feel like, that really is kind of behind the times. It just doesn't really take into account some advances, some things that we've learned. So let's get going here. First of all, I want to show a couple of my kids. People like kid pictures, So I have 9 children. I've been blessed with 9 children, and a couple in heaven. But these are a couple of my younger ones. Lucy is on the left, and Martin is on the right. So Lucy made her first basket today in a basketball game, and everybody cheered. I have 4 daughters to start, and then out of the last 5, I have 4 boys. And then Lucy came. So Lucy has Down syndrome. And as a physician, we know a lot about Down syndrome, but until you have a child with Down syndrome, it's hard to it's just like not having a patient with something that you've never seen. I mean, what did I see the other day? I'm trying to think. Oh, I saw a pressure ulcer on a young boy. I've never seen that before. So there's always something new, and it really sticks with you. So I've learned so much from my daughter, and she's a real sweetheart. And so for any of those out there who have contact with children with Down syndrome, I'm sure you know that initially there's a lot of apprehension. How will I connect with them? But as time goes on, it's really a gift because you understand people better than ever. But anyways, a couple of kids, a little bit about me. So my goal is here to introduce you to the basic principles of Catholic medical ethics, define some key terms pertaining to the beginning and end of life issues, and familiarize you with the principle of the double effect. This is kind of difficult. It's kind of hard to understand. There's different takes on it, but we'll do a couple cases, and hopefully you can look this up anywhere, but I'd recommend you go to the NCBC to hear more about it. And then at the end, I have some things, illustrate some practical application, as I said, and then answer specific questions. I thought, what are some of the things I've just heard from people, and it just makes me go, I think I could help you with that, or that's a good question. So that'll try to be a way to get some interest going. Slow transition. What's going on, Brian? So I tap that. Looks like I'm rewriting my slide. I don't know. He switched me to a MacBook right before I started.
That. So it's here, but
Not seeing it so well. So should we switch where we do the mine with your...
so we've got that. Mm-hmm. Here are the objectives. Okay. But you're saying this should load.
Yeah, it should show right there.
That's what you're telling me.
I've got a paper copy, but they can't see it.
They're really smart, and so they'll pay attention, and before you know it.
What do you think, huh? All the techies.
You know what?
Make it simple.
Well, I'm wondering if, I mean, you can tell that there's.
I used all my jokes already. So.
It's in white.
Over on the left side too, Brian.
Should we just switch to the...
What's your background? You can change.
Good. Yes. Okay.
So go back to the go back. Okay, so see where it says change master?
Yes.
See if you can just pick a dark one. There we go.
This is awesome.
Yeah.
I'm sorry I have food and beverages in the room. All right, Dr. Luea, can you entertain them for like 2 minutes so I can fix this?
Well, my singing voice isn't too good right now. So.
We don't have the right connector.
Okay.
Because,
Yeah.
right.
Yeah.
I think we could just change the fonts.
I think I'll just use mine. And then someone will just have to advance it, that's all. So we had my HDMI here.
Is that working?
Well, yeah, my HDMI works, but it wouldn't reach, so I couldn't like advance it. I just need somebody to advance it. It's really, from here on, it's not too complicated because I don't make it that way. But I don't know, where is it? Is it just one of these?
Go above that. Try that.
So, all right.
Did you see the arrow? Does it go
Probably that does it too. Okay.
Bob's going to advance the slide.
I just needed to have someone help me. Does the mouse work from there?
I don't know.
That would be something, wouldn't it? Enough messing around here. Well, I'll just tell you, somebody told me, if you're going to prepare for a talk that has to do with teaching people.
How's that mouse stuff? Does it work?
Oh yeah, you had it plugged in the other one.
Click, scroll.
Wow. How do I go back though?
Father will fix it.
Wow, let's hear it for Logitech, right? All right. I wasn't even paid for that. No, but people say when you're going to give a talk like that, you're going to get some spiritual warfare. I was like, yep, probably, sure. I think, what did my wife say? We had 3 bloody noses this week in the house. I had every computer glitch that could ever happen. I had to go online and solve this laptop. And I'm like, I don't know. I'm not sure what spiritual warfare is supposed to look like. Oh, and I came down with laryngitis. But this kind of looks like it. So you better listen. There's probably something here for you. So some of the really basic stuff is Catholics' bioethics are based on the concept of natural moral law. And now it's kind of heady thing, but I would say, and I think it's on another slide, but understood in the light of revelation, so that's our faith, that's over time the tradition, the magisterium, interpreting the law. And then the third point on that was the dignity of the human person. So I really think that John Paul II really, if you look at the development of modern Catholic ethical principles, a lot of it came out, since I think it's John the 23rd, Paul the 6th, John Paul II, Benedict's yeah, absolutely. So a lot of the documentation and the letters and everything that's been written has been updated in the last century. And why would that be? Because technology's changed. So, before 1968, we didn't have a reliable form of birth control, or a little bit earlier than that. And so now we have a whole different challenge to the concept of what's okay in the conjugal embrace. Law is called natural because it properly belongs to human nature. And what that means is that everybody knows this stuff. Okay, and St. Paul talks about that, Romans 2nd, verse 14 to 15. And he's talking about that we all are accountable to the law because it's written in our heart. All right, so isn't there times when you think, why don't those people get it that abortion is wrong? How can they do that? How can they think that way, And so I think, one of the most profound, I'm not going to get into abortion that much because I think that gets a lot of time. But, one of the most profound things I ever heard was, they're fighting over the definition of pregnancy, if it's really a person or not inside of a person. And they're in the lobby. This was a woman telling this story as a pro-life. She was a lady who her mother attempted an abortion, and she survived, and then she was born. And she said, I was running into some politicians in the central chamber of one of the capitals, and there's a lady there who's pregnant, and we're having this kind of brief little discussion, and there's a publicity thing, and it's like, we're here, we're pro-life, and you can't be in here, and you can't say these things. And this little girl sees a woman walking by who's pregnant. She goes, "Look, Mommy, a baby. A baby." So I think it's in the heart of all of us, but we're pretty good at sometimes making it harder for us to see things. Sometimes it's ourselves, sometimes it's just the way we are. And the precepts of natural law, as I said in the end there, they're not clearly perceived by everybody. Sinful man needs grace and revelation so that religious truths can be known. Next, please. The Greeks, our Western culture, I'm not an expert on Western civilization, okay? My daughter's at Hillsdale right now trying to become one, so I'm going to have to defer to her. I see a Hillsdale grad out there, so. But anyways, the next speaker is Nathaniel Schluter, is that his name? And he's from Hillsdale, you should come. He's going to give you some good stuff. But the Greeks, as far as physicians, I sort of look at, they talk about virtue as being excellent according to one's nature. So a real simple thing is if you've ever looked at race horses, they are bred to be fast, to the point of devastation. They break ankles, they can only run a couple different races, but that is considered an excellent quality of virtue. And then also, I got into a little bit of horticulture, just something I could do that didn't hurt anybody. And I had an acre of land and I planted several fruit trees. And so the most important thing about a fruit tree, besides pruning it correctly, is getting good fruit. So if a fruit, and Jesus cursed a fig tree, didn't he, in the scripture, because it didn't bear fruit. So he also believed in the virtue. He did. So, but in order to know that, you have to know what you were meant to do. What is excellence in health? What is excellence in a human person? And I think we have a lot of confusion about that now. So we can't, as I tell patients over and over, take the Bible, try to read through the first chapter of the Bible, not the book, just the chapter of Genesis. You won't be able to get through that chapter and agree with most Americans. In the beginning, God made the heavens and the earth. Okay, then he made man, and he set all creation under their feet. He made them both male and female. He created them. There's some really, we don't have a lot of agreement. We can't even get out of the first book of the Bible. So what is the point of us? What's the purpose of us? Every human, though, everything we do is intrinsically moral, and ethics are concerned with moral actions. Is it right? Is it wrong? But it's moral, okay? Next. I know the dog, they always say, bad dog, you know, like the dog bites you or something. As if it's a moral act, but we still don't like it. But when we do something bad, we don't tell our kids, bad boy. Oh, don't do that. Because we're going to crush them, right? Because we know that they are good. They are good. You know, God made our children good. And we want to call the goodness out of them. And we want to hate the sin, not the sinner. Okay, so the light of revelation. The Catholic Church has claim to this. Deposit of faith, you know, Jesus said to the disciples, go and tell this to all the nations and baptize them in the name of the Father, Son, and Holy Spirit. And so he gave them the authority and the interpretation of our magisterium in the church, which again, I'm not a theologian. I'm just a doctor who tries to do the right thing. You know, I trust that the Roman Catholic Church has the right understanding, because new technologies will come up, new questions will come up. How do we make our best decisions? The ethical religious directives was that little part at the end I already talked about. Hippocratic Oath. How many have heard of the Hippocratic Oath? Me too. You ever read it? Some people have, yeah. I knew. Good. Well, I read it again, okay? It was a translated version of it. I don't speak Ionic Greek, so. But basically, this is really it was maybe the third, maybe people say maybe through the 5th century, and it was a formulation that has been used, and it's remarkable. I had a neighbor kid, homeschool kid. He came over and he wanted to interview me. He's a Protestant brother, and he wanted to interview me on how I incorporate the Hippocratic Oath into my practice. This was about a year ago. He's smarter than I am, I can tell you right now. I looked at it and I said, well, you know, I actually haven't read this in a long, long time. When I went through it, I was really impressed. I was really impressed how timeless. You know, St. Paul says, you know, Christ appeared to us in the fullness of time. There was a lot of thought that had developed that was ready to understand Christ, the Logos, you know. And the same is said for medical ethics. So what we get mainly out of the Hippocratic Oath is that there was this whole part about, you know, I will honor the gods, so there's this sacredness to the duty that you have and the information that you have as a physician. And beneficence, which is, it doesn't exactly say do good, do no harm. You've probably heard of that phrase. But that really is like something I think about every single interaction with a patient, especially prescribing medications, they're like, what do you think, doctor? Should I have the surgery? Should I wait? Should I get another CAT scan in 6 months? Who's the best person? Well, the internet says this person's really good. Well, should I tell them that I don't think so? And let them go figure it out that it wasn't a good idea? You know, so this stuff is everything we do is all about beneficence. Confidentiality, big deal. You know, electronic medical records, HIPAA. Have anybody have to deal with HIPAA? It's this kind of thing you want to curse about, you know? You just want to curse about it. But it's not, it's necessary because I thought, I can't think this one through, but have you ever sat around and thought, what if people wouldn't steal things? Or what if people wouldn't lie? Like, what would that do to all these structures in our world? We wouldn't need HIPAA, I can tell you that. But we do need it. And then in the end, this is the thing that really sets us apart. We can have all these ideas and things, but we need to be loving, Christian loving, agape loving people. And I think that, you know, even if doctors, there's a lot of doctors I've worked with who probably wouldn't sign off on everything that I think is ethical or not, but most of them are very, very concerned about their patients. You know, there's some selfish people. I mean, we all are selfish, but it's the nature of applying knowledge to healing and helping and caring and curing is by its own nature, it changes you into a better person. So I'm very grateful that I've been able to practice medicine and continue. It's made me better. Next. So has been married for 20 years. So the big five, there's more, but this is kind of the big five from the secular end of things, is beneficence, we talked about that. Non-maleficence, do no harm. Do no harm. And so back then, in the Hippocratic Oath, it was, I will not give a poison. I will not give a poison to somebody, which behind that was also included euthanasia. You know, it probably also was like assassination attempts. things like that, because they had access to potions and things. But it also meant they wouldn't kill somebody who wanted to die before the natural time. Justice, and it comes up a little better in the next. Autonomy. Now this is a really big issue, and I think I'll touch on it at the end. But this is the concept, and it goes with our Catholic faith, which is we have a will, and we have a free will and an intellect, and we want to respect those and integrate them and not try to. I remember in middle school, and I remember I'd hear this guy. I like girls in middle school. Anybody like? You don't need to raise your hands. I like girls. Some of them are really. It's just suddenly they seemed really interesting to me in middle school, and I remember this one guy. And man, was he smooth. He was so smooth. This one girl had something happen to her, and he's right there. And I was like, how does this guy know how to say all that stuff? He's like, oh, let me hear him put his hands on her face, wiped her tears. He was so reassuring, and I was just like, oh my gosh, how does he know that? I don't know any of this stuff. So, but anyways, he was kind of manipulating her because I knew that he was looking to see if he could kiss her. That's what it came down to. Probably did. But I remember thinking, man, we can't do that. We can't manipulate people. That's not right. You can't do that. I could probably do that, but I can't do that. And so that's the autonomy. Like, you don't manipulate people. As a physician or in other careers, I see an engineer out there. I see a bunch of experts. If you know something and you don't let the person know who has to make a decision that impacts their life, is that right? Absolutely not. It's not right. Now, sometimes you got to make it easier for them to understand, but coercion is a big, big no-no. So we all know that. Confidentiality, we talked about that. That's an interesting flex sometimes. Here's the Christian ones. So totality, this is an interesting term. I'll just run through them and then I'll come back to them. Sanctity of life. I think we should all know that one. I mean, it's been very, Evangelization Vitae is all about that. Donum Vitae. Ordinary versus cooperation. It's a big one, we'll hit on that. Ordinary versus extraordinary. And the principle of the double effect. So totality, all persons have the right and duty to protect and preserve their body, okay? So this is why is it wrong to kill myself? Because you're violating the principle of totality, okay? You have a soul. This is what they tell me. You have a soul. I know about the body. They're together, okay? You're not to do anything to either one of those, okay? That's wrong, bad, that are against the nature of it. So, like an example that makes this real, the functional integrity has to be preserved. The functional integrity may be sacrificed when no other morally permissible means are available. Okay, so this is kind of hard to understand, but what they're saying is, like, for example, if I know heroic people who have kidney failure. It's a good example. So your kidneys are failing, you're on kidney dialysis. You go 3 times a week, you spend 3-4 hours. It seems like pretty easy, but it's very hard on the body. It's not a good way to keep going for a long time, maybe 10 years. You need a donor. How is it okay to give somebody one of your organs? I mean, aren't you violating the principle of totality? Well, that's where the functional integrity comes in. You can function with one kidney just fine. Maybe you have to quit your football career, but you can function without. Now, what about donating your heart? Like your child is dying and they just need a heart, or a piece, maybe they need a liver. Well, it just depends, right? No, you can't donate your heart because that would be, and no one can donate it for you. So that would destroy your life. You would lose your integrity between the soul and the body. Cancers, I think we take it for granted. Yeah, I can if I've got a cancerous tumor in my jaw, I should probably get rid of it. I can take it out. Well, how isn't that violating the principle of totality? Well, you still have an integral functioning body. It's not the end of your life. It may be a lot harder, but that's okay. No euthanasia or abortion, these things, I think you can see how they violate the principle of integral function of the person. And sterilization, this one, we may have people in the audience that are like, wait a minute, isn't that okay? We'll get back to that. But perfectly functioning organs, if you don't like what they're doing, you're not supposed to destroy them. That's all there is. I heard a term once that stuck with me. It's called the sin of mutilation. That doesn't sound very good. I've noticed, here's another thing. I've noticed a number of kids who are really under a lot of stress, and they have done some cutting of their skin and things like that. So, we don't want to make them feel guilty. But if you do get to a point where they're like, well, why is that not okay? I think they usually know. They don't usually show it off. But it could violate the principle of totality. I'm not going to get into piercings and tattoos. So now one of the terms that comes up a lot in abortion is like, it says in Humani Vitae, direct abortion is never morally illicit. Okay, that means you can never justify it. But it says direct abortion. Indirect abortion, if you didn't know it, there are cases where if you're treating something and the baby is affected by the treatment to the point of even death, that there can be permissible situations under Catholic bioethics. So a lot of people, I hear this one, and I'll get to that later, it's like, what about, isn't it, I'm against abortion except for the life of the mother. Except for the life of the mother. I got somebody out there that could help me on this if I need it. Ed Rivet. So there's something about that is true, but something about it isn't true. So we'll go through that a little bit later. Then responsible parenthood versus contraception. I've had Protestants I've talked to them about, Catholics are only to use natural means of family planning. How is that different than contraception? We should be able to answer that question. Euthanasia, that means the good death, and that means when somebody is not actively dying, that we either withhold treatment or we do something to them, give them a lethal injection before they have died because they have something they're facing that they say, I don't want to go through that. I don't want to go through it. They're not usually completely out of their minds when they feel that way. They're very, very scared. But licit and illicit fertility techniques also falls under sanctity of life. Next slide. So this one is something for a lot of people to think about. I definitely think about this myself. I've talked with my wife about this. She's a pretty good counselor on this. She's not afraid to tell me, you're full of it. So explicit formal cooperation. Cooperation means cooperation with evil, okay? So I always tell people, when you go to the gas station and you buy gas, and you go in there and you're friendly, and then you keep going to the same place. I like to go to this little roundabout in Diamonddale. I like that place. They got the Woods and Water magazine, lots of good stuff there. They even have some good beer in there. But the gas, I get it in there. I bet you there's some people in there that benefit from me using that service that I totally disagree with, that are doing things that are totally contrary to what I believe. Is that okay? So this is what cooperation and material we're talking about in particular. So explicit formal cooperation is when a person, for a good reason, a good aim, establishes a structure by which an immoral act will take place. So this part, a lot of doctors are going to disagree with me. I know. I think we don't get into each other's business a lot. We don't. But this is where I would say my thing about referring people for an abortion or saying, okay, you need a sterilization. Here's the man. I'm going to send you to him. I can't do it, but I can send you to this person. I don't want to get in the way of your autonomy. It's up to you, but here's the right person. Or setting up a situation like some Catholic healthcare places. I remember one, I'm not going to use the name, but I heard through pretty good sources that a place tried to avoid, they had a healthcare plan and they wanted to be able to not exclude people that wanted abortion services, but they can't specifically have that. So they had a dummy company work for them, provide the financing, everything, and they just kind of let it go. Guess what happened? They got embezzled. So you make a deal with the wrong people do what they do, right? So that would be like an explicit, I thought it sounded like a lot like explicit formal cooperation. Material cooperation, oh yeah, and up there like a prescription, like somebody says, I'm pregnant, I had sex last night, I heard that if I take some medication now, I might not get pregnant, and so you write a prescription for him. You're like, that would ruin her life. I don't want her to get pregnant. I'll give her the morning after pill. There's a lot of things wrong with that. Material cooperation, assisting. So for example, proximate, they have these big terms, so basically, are you right there handing the scalpel to the doctor who's doing the abortion, or are you helping put them under, so if you don't do your job, then this abortion can't happen. Abortion's the easiest one because it's never okay. So that could be illicit, but not if it's direct, like I'm handing this thing. Whereas the example in the NCBC one was there's a guy who mops the floors, the janitor keeps the place clean. Could he be, but he doesn't want to go to a different place where they don't do abortions because his family would suffer from no income. And they say, well, there might be good enough reasons to keep working in a place like that because you're not directly assisting, but it is essential that you do that or they can't keep doing that. Of course, they could probably hire another person. And then the last reason, I think this is something that's really important, I've certainly wrestled with this, is scandal. So the concept of scandal in the sense is the perception of wrongdoing. It's difficult to explain. So when I first started getting into medicine, I encountered some Catholic places and I was like, oh, this is going to be great. They're going to all agree with me on this stuff. Nope. No. So it was disappointing. I thought, if you were Catholic and you had all this clear teaching, certainly you'd want to not do inductions before children are viable in your hospital because they have a fetal anomaly that looks like it's going to end, with a person with a baby with Down syndrome. I mean, certainly they wouldn't do that in a Catholic hospital. Don't be disappointed. So hopefully things are improving, but there's a lot of people that, they're really compassionate people. They really love the patients. But they go too far with autonomy. We should be speaking to the world what we have been given. And I heard something like maybe 40% of healthcare is delivered by Catholic healthcare systems, at least in name, and there's super clear teaching. If they were really faithful to things, it seems to me like the debate would shift a lot. And many of them are. I'm not here to condemn. I'm just telling you. If you haven't run into that, then if I'm really surprising to you, that might be why. So, ordinary versus extraordinary. This comes in mainly at end of life. I was trying to picture what kind of demographic are going to come tonight. Who's going to be here? And I thought, well, there's probably going to be older people who have time and they like wine and cheese. And they might have already thought about this, like, if I had a really bad problem, I don't want to be around. If I have no quality of life, like I can't drink wine, eat cheese, don't remember my name. I'm a huge burden on my family. These are big issues that people are going to run into. Ordinary means, so the church has a sense of there's ordinary and extraordinary medical care. Ordinary are things that are reasonable, hope of benefit. For example, you come into the hospital. I just had a couple patients this last week. They go into the hospital and they're confused. They're coughing. They got a fever. They find out they've got pneumonia. It's pretty bad pneumonia. They get put in the hospital. That would be considered ordinary care. They didn't get put on a ventilator. They just need antibiotics, IV fluids. Especially in a first world country like the US, that would be ordinary care. While they were there, people changed their sheets. They checked their vitals. They were able to have visitors. They had food. These are all things that we do, like we'd say care. You'd think maybe nurses do that stuff. They do. They do a lot of the care. And those are all ordinary means. Things that, sometimes when you visit somebody in the hospital, like one of my favorite things, I did hospital work up until 10 years ago. I worked at all both hospitals in this city, and my partners, Dr. Meir and Dr. Huizenen, we were heroic, I think. We would do pediatrics, adult, we'd do people in observation units, people getting surgery at the surgical center. It was exciting. You got to really practice. And one of the best things I think we could all agree we did was when we walked into a room, the patient was so reassured, because oh, somebody knows me, somebody knows me. And so that was really, really, really helpful. And a lot of times what we did was just made sure that they were getting cared for, And then we had, we did the higher stuff too, but talking to them, holding their hand, listening to them. Oh, you didn't get that thing done that I asked? I wanted those warm compresses on your right elbow so that the antibiotics would work and you wouldn't be in the hospital forever. Oh, they haven't been doing that. Okay. hey, you better do this. 2 days later, they're out of the hospital. So this is ordinary care. You can do it extraordinarily well. You can do that. Try to. Extraordinary means no benefit, excessive burden. So there is a place in Catholic healthcare where it's too much. It doesn't make any sense. So the most common example is, you're really old. You've had a couple strokes, you have another stroke. It's horrible. You can barely, you're swallowing your saliva, can't keep your airway. Do not resuscitate. You probably heard of this. So, and that's something that is clearly a good idea, and there was a term, I can't remember, I came across it, but it was basically the person who wants everything done no matter what. I don't see that a lot around here, but I think we understand that you don't have to do everything that medicine can possibly do to keep yourself alive, to preserve the principle of totality, okay? We can go to the next thing. Double effect, intimidating. So I tried to make the slide as simple as I can. So when you're going to do something, and it will produce a good, but it'll also produce a bad effect. How do you know if it's okay to do? That's the principle of a double effect. So you have to do all 4 of these conditions, and this is a Catholic moral principle. So the first, the act is morally good or morally neutral. So for example, it said in Humani Vitae, direct abortion is never morally illicit. Okay, so that can't be okay outcome or effect for another good. So like the biggest example is, let's go back to a baby is found to have severe anomalies or something, and they're like, well, let's just do an abortion so you don't have to deal with this. Because the psychological trauma is going to be so hard on this mother. Not to belittle that, but it's clear in Catholic medical ethics that is not a good enough justification for direct abortion. It's not. There is no justification for direct abortion. Only the good effect is intended. We wanted this to happen. We knew the other thing would happen, but we had good intentions. So a lot of people get stuck on that. They feel like anything you do, as long as you had good intentions, and that happens not just medical things, right? I really was trying my best to get the right thing. Then the bad effect is not the means. So, and then there has to be a proportionately grave reason to permit the bad effect. Proportionalism is a dangerous word. Okay, it's a dangerous word. So it works great if you know that it's in the first place okay to do one of these things. Okay, but if the Catholic Church says this is never morally illicit, then you can't use proportionality to determine if it's morally illicit, because it's not. So it's how that works. So I was kind of getting ahead of myself, but let's say a baby has a fetal anomaly at 23 weeks of life. Before that, pretty much babies don't survive outside of the womb. There may be some cases, but let's just use that for discussion. And the baby has Edwards syndrome, trisomy 18, trisomy 21, Down syndrome. And there's some other ones that are more lethal, or ancephalic, no head. Okay, so but let's not use the ancephalic, because that baby was not going to survive outside the uterus at all. These other babies might, very serious problems. Everyone recognizes that. So they say the mother has, can we go back to that next slide? The slide before. We're almost done. The one before. So the act is good or morally neutral. So an induction at 23 weeks or less than, I think it was 400 grams. That's a tiny baby. An induction is neither morally good or neutral. So it meets the first criteria. We induce babies all the time for good reasons. Only the good effect is intended. So in this case, the good effect is we don't want to have a very difficult life, and we don't want the baby to suffer. It's all psychological things. Okay, so that's what they intend. They don't really want the baby to die if they didn't have, but they want to save the mother and keep the baby, not to suffer is the intention. The bad effect is not the means for the good effect. Can't really get around that one. So the bad effect is the baby will die, can't survive, and that is the way that the good effect is accomplished, which is the baby won't suffer and the mother won't have to be traumatized. And that can be debatable that the mother doesn't suffer, right? Of course. So a lot of people regret things like that. And there is no proportionally grave reason. So let's go back to that slide again. Let's look at similar situation. Early induction for severe preeclampsia, HELP syndrome. Okay, so the mom, as far as I know, the baby was doing fine. The mother is not doing fine. So the blood pressure is up, liver failure is occurring. She's on the verge of seizures. She's going to die. Okay, she's going to die. So life of the mother. There's another example, chorioamnionitis, infection of the placenta. So usually what would be okay to do in this case is, well, by the way, if the mother dies, what happens to the baby? The baby dies too. So in this case, we can go back to the slide before. Okay, so the act of induction, morally neutral or even good in this case, to save the mother. Only the good effect is intended to save the life of the mothers. Maybe the baby would survive on a long shot. The bad effect is not the means for the good effect. Now, actually delivering the placenta part will save the life of the mother and the baby. And so it's not considered the same thing, like the means, and it's the life of the mother. So the last one is the proportionately grave reason. Life of the mother is a very, very grave reason. The baby. So here's let's go back to what is the good effect. So the good effect is the mother, second here.
The condition ends, right?
Right. The condition is over. Yeah, they fix the problem, and the mother survives. The baby dies. The good effect, the bad effect is that if they didn't do it, was that the baby and the mother would die. So, and there's a proportionally grave reason to permit the bad effect. So now you can talk to the NCCB about that one if you don't. Permanent sterilization, kind of double effect. You can go back through. We're going to flip back on both of these. The act is good or morally neutral. It says in Humani Vitae, direct sterilization is never morally illicit, so we can't get past first base on this one. I think the good effect is intended. Many people are trying to regulate birth. That's totally acceptable in the Catholic teaching. In fact, it's promoted. The bad effects is not the means. So this mutilation of the vas deferens or the tubes is considered mutilation. That's the means by the good. And so anyways, that's just an example of how the double effect can work. Next one. Tubal pregnancy. Woo. This one's tough. So the church doesn't, by the way, some of these don't have magisterial answers, okay? You do the best you can. I was a little surprised that this one didn't have a magisterial answer. But if you go by moral theologians, they have a recommended way that they mostly agree on, and then there's controversy over two other things. And I'll tell you what my personal understanding as a doctor who's been there. So first, a tubal pregnancy is when fertilization of the egg occurs, comes down to the fallopian tube, enters the fallopian tube and gets stuck. It usually takes 7 to 10 days to go from conception to implantation in the uterus, preferred place. But if it's in the tube, then eventually this is going to outgrow its surroundings. It's like a tiny house. Not going to work. It's a neat idea, not so good. So most of the time, clinically, we suspect a tubal pregnancy when the woman has abdominal pain and vaginal bleeding. And she has a positive pregnancy test. So right away, we're very concerned. Because if this grows into her tube and it ruptures, she could bleed to death. All right? And the baby is not going to survive no matter what. There's no way I have no record of a tubal pregnancy going to term. So that kind of lays the ground for what are we talking about here. So the act is good or morally neutral. So the preferred, I'll just get right to the medically preferred method, and the standard of care probably would be using methotrexate. I'm just telling you what most doctors are going to recommend. Methotrexate. So methotrexate basically stops DNA from replicating itself. It's a chemotherapy agent, and there's a dosing protocol, and abortion clinics use this too. And you have to get a shot of it early enough, and then you have to get another shot. Now that's for regular pregnancies. Tubal pregnancies, there's a protocol. Many Christian OB-GYNs feel that this is okay to do. So methotrexate goes through the bloodstream of the mother, and it integrates into the chorion, which is going to become the placenta. And that's what's attached to the mother's tube. So the tube is getting damaged, and the medicine goes in there, the poison, and it kills the chorion. So they say, we're not trying to directly kill the baby. We're trying to get rid of this invasive chorion. Well, I'll just tell you what, well, I'm getting to my idea about this. Let's move to the other approach. And usually it's very effective. So the next thing is to go in there, and especially if you can see on an ultrasound, oh, there is something in that tube. You can go in there surgically, laparoscopically, and you open up, salpingotomy it's called, and you open up the tube, and you take the pregnancy, the fetus, the chorion, you take it out, and you sew the tube back together. And that preserves fertility for the most part, and gets rid of the problem. Then the third one is, this is the one that everybody agrees is the right way to go, except for my wife. She's like, are you sure? I'm just telling you what I learned. It's salpingotomy, and so, or gectomy. So you're going to take the tube, the pieces around the tube, or the entire tube out. So you lose fertility for the most part in that tube. I've had several patients get pregnant with one tube. So it's not like you just eliminate all fertility, like kidneys. But it's different because you're taking the tube out that is damaged, and you're not directly killing the baby, you're taking the damaged tube out. So they agree that that's not direct abortion. The other two methods, that's the controversy, is that direct abortion? So, when you go in there, you open the tube and you take out the entire situation, is that it seems like you're doing direct abortion. That's what it seems like. But that's better for the fertility. And then the other one, the methotrexate, I remember, I won't say which hospital I was at. By the way, I do work for McLaren, and my opinions are my opinions. Not necessarily the opinions of McLaren, okay? Just so you know. I like them, but I don't want to bring them into this tonight. So I remember seeing an ultrasound, and this was a what we would call a botched abortion. So you're at the hospital, and they have to take anybody that doesn't have a doctor, and they come in, and I think it was about 30 weeks. And I looked on the ultrasound, and it was one of the most horrific looking things I've ever seen. I saw parts of bone, I saw parts of kidney, I saw spinal cord. This was the growing embryo, now a baby. And what had happened is they'd gone to an abortion clinic and gotten methotrexate, and then, not being a real responsible kind of person, they didn't come back for the next shot and to make sure everything was done. So, the people that were looking at it, they were horrified. I don't know what their stance was on abortion, but they were horrified. They didn't want to see this. They were very upset that this wasn't done correctly. But the reason I'm bringing that up is because clinically, even if you want to sit there and say, I argued with some of these theologians when I was out there, because I just said, I don't think that's really how it works in real life, So for example, if you give methotrexate, that goes into the chorion, but it also goes to the baby. It goes to the baby, and the cells are rapidly dividing. That's why your HCG levels go up so quickly in the first stages of pregnancy. So to me, I can't see how giving the poison, there's no way to make sure that it only goes to the chorion. And then that's a whole other question. Is the chorion part of the baby? The placenta. I mean, we discard the placenta at birth, but it's pretty much the organ that keeps them alive. So anyways, in my opinion, I don't feel comfortable with that. And all the people talk about the other one. But if you ever got in a bad situation like that, things have to be decided quickly. You have to trust physicians. Probably most of them won't be this picky. They won't. But if you ever, get in a situation you can ask me or go to NCCB or ask Father Steve. I'm sure we can remind you of the technical stuff. Next. So anyways, this is kind of like my way of covering some things. I might have already hit some of them to try to draw some interest into this. How much time do I have, Brian?
As much as you want.
Really? Is that what you guys think? Okay. So I don't have these on my paper, so I'm going to stand like this, all right, so I can see. So these are kind of like riddle type things, but these are things I've heard. I really have heard these things, and I think they're good ways to kind of bring out some of the ethics and things that we believe as Catholics in our teaching. Is it okay to use the morning after pill if you have a negative pregnancy test? I mean, you're not pregnant yet, right, Dr. Mir? You're not pregnant, right? So this kind of brings out a definition thing, which is early on I would say, I don't want to get myself, I don't want to blame a bunch of people, but if you look at my textbooks, I had Williams Obstetrics, it's called, and if you look in there under how they define pregnancy, they define it based on a positive pregnancy test. And as you look into it, you find that was changed around the advent of abortion being legalized. And so you can see it's semantics, but they're important. So we believe as Catholics that life begins at the moment of conception. So there's a unique fusion of egg. The two gametes become 46 chromosomes. This is you. And there's no way to tell when the soul comes or not. There's no way. So we have to say it's at the beginning is right there. And then I told you in the tubal pregnancy example that embryo is going to maybe take 7 to 12 days maybe to implant. And then once it implants, that's when the pregnancy hormone is released into the mother's bloodstream. So you have a window where you're pregnant, but it hasn't implanted, so there's no way to detect it. And this is where the morning after pill can be effective. It actually is not effective if you have a positive pregnancy test because it usually can't knock a newly implanted trophoblast, as we call it at that point, off of the lining of the uterus. So it's a good question, but as Catholics, the mechanism, there are some cases where, let's say you were raped, okay? So this came up a lot at the conference I was at and other discussions because these people are running emergency rooms and they want to be sensitive to rape victims, but they don't want to violate Catholic teaching. And now you can get the morning after pill. I saw it at Kroger. I think it was like $79 you could get it. So they've kind of gone around. You don't need to go to the emergency room or the physician. So in some ways as a doctor, you're kind of like, well, I have to deal with that one as much. But on the other hand, you're like, it's not so great. Especially what I told you about the methotrexate example. It's dangerous. But so they were talking about, could we find, if someone was attacked by a patient, or the patient was attacked, raped, it's not part of the marital embrace, I should say something real quick just to set this up. Okay, so why is contraception not okay? So from Humanae Vitae, and I'm going to borrow heavily from Janet Smith. So hopefully if you've never heard her, get one of her CDs or whatever they do now, MP3s or podcasts. Take a listen to it. I thought she did a very, very good job of taking a complex issue and making it simple to understand, simple to check yourself with. And she said that under Catholic teaching, the reason why contraception is not okay is because every marital, so not unmarried, marital act needs to meet these requirements that it is both possible to make babies and that it is bonding. So she said babies and bonding. That's what it has to have, babies and bonding. So if you use that, it means that it has to be potentially leading to pregnancy or leading to begetting of children. And it also should be furthering the commitment of the physical embrace. And so there's good teaching on that, but I'm just giving you some babies and bonding. So if you do the morning after pill, like the reason you couldn't do it is because it would be abortion is wrong. But what if you were attacked by somebody and you came in? So one of the things, and again, I'd have to check with, I know Marquette University was trying to figure this out, but you may be able to tell when if the person has not ovulated and was about to ovulate. Okay? So there's a baby getting ready to be made if the guy attacked her, sperm is going up inside, and you don't want her to ovulate. She hasn't ovulated. If she doesn't ovulate, she can't get pregnant. So if you could do maybe an ultrasound and see if she has a follicle that hasn't left, then you could maybe do something like use these kind of medications to prevent ovulation. Okay? So that's an idea. I guarantee you it's a gray area. But and the other thing is, how can you tell if they've ovulated? Well, there are progesterone levels that go up generally over 2.5 usually when you've ovulated. So if you did a stat progesterone, and you did a transabdominal or transvaginal ultrasound, just what they want right then, and you're like, hey, they haven't ovulated, we can do this. They have ovulated. As progesterone's there. You can't do it because you could prevent the implantation of a fertilized egg. It's not the baby's fault. It's not the baby's fault. But it is a touchy subject, and so that's just an example of how you try to work with your principles and also try to be, respect the patient and their situation. I think there's some stats out there that say that it's not that common that a rape victim does get pregnant, which is merciful. But I don't know those stats. And I don't work in the emergency room. So embryos aren't people yet. I've heard this from other doctors. I've talked to some doctors and I was like, hey, I don't know how I can say this without, I want to give you details because vagueness doesn't help. Well, anyways, there was a relationship that we were looking into as a group, and it would be involved in bringing in people that did artificial reproductive technology, so they basically help people have babies outside of the uterus. And there could be a financial arrangement that I would be involved in. So I was trying to figure out, is this going to happen? And if it does, I need to tell you, there's no way I can benefit financially from this at all. And I talked to another doctor that I thought would, because I knew they were Catholic. And they said, and it's super intelligent. I mean, I just owe a lot to some of these people. I'm not going to say any names. And they said, well, this doctor said, I don't think that embryos are considered humans yet. And so you might be surprised at some of the things that people have held on to, and that would be rather poorly thought through. So no, we believe that embryos are humans. And that leads to all kinds of interesting things, doesn't it? And we talked about abortion and life of the mother. Here's another one. Maybe in this crowd, this is more common. We're using NFP, but we don't want to have any kids for a while, Or maybe we're really making some progress at bringing better education, better support for couples that want to follow the church teaching on natural family planning in the diocese and all over. I mean, I was in a meeting, and I hadn't been in a meeting about that specifically in over 10 years, and I was really encouraged. I was encouraged at where we were at as far as having clergy that understood that this was important, that it was correct, and that there were people that had an expectation that, yeah, I could go and take a class on this, and if I want to get married in the Catholic Church. And so I'm really encouraged. But I heard some things, and I thought to myself, that doesn't sound like the spirit of it, So we as Catholics, we're so hard on ourselves. Like we're not just doing we can't do this thing or we have to do this thing. We have to do it for the right reasons, and the right time. And thank you, Aristotle and Aquinas, right? So, but you guys know that's true. So, the spirit of it, there are the church teaching, again, most of it comes from Humanae Vitae, is that they do believe in responsible parenthood, okay, but not contraception. So when we were first married, we lived in Ann Arbor, Sue and I, and we had these really, really friendly neighbors. We lived in a townhouse. She was expecting my daughter Elizabeth, who's sitting next to her, and they came over and they offered us a lot of things to help us with our baby because they're Baptist, some type of a small Baptist church. And they really were concerned about our salvation. They really were. And so it was interesting because I kept having conversations with the man, and we had a friendly, they were trying to love us, they were loving us. And I tell him, yeah, that's absolutely true. And yeah, I remember in Corinthians, and he's looking at me like, what? How do you know anything in the Bible? And so, anyways, but one of the things that I picked that struck me was that their church taught that they should always be open to another child. Like they should never do anything to prevent future pregnancies. And so I kind of coined the phrase in my head, supernatural family planning. You know, maybe someone else said it too, but supernatural family. Yeah, and it's an interesting argument. Is it ever okay, since the Lord is the author of life, is it ever okay to say, I don't want you around here? And the answer is no, it's not okay to say, I don't want you here right now. But it is okay to say, oh, you're not coming today? Okay, well, we're gonna have sex today because you're not coming, and you won't bring a new baby. So it isn't okay. I agree with them to close the door on the Lord, but the church does promote responsible parent. And then the question is, well, what's that mean? So that gets kind of personal. You know, it says significant financial pressures. Maybe there's health reasons for the mother, and then it does say psychological concerns. So how many people don't raise your hands? How many people feel like I can't handle another kid right now? I mean, I really can't. That's okay. Maybe you can't. So please be nice to people if they have 1 or 2 kids and you have 7, and don't, you know, isn't it weird? It's like a reverse pressure thing sometimes. Oh, she's not breastfeeding. I hope the formula doesn't cause problems. Praise God we have good formula now, you know, we really do. Okay, so why is, other thing, NFP, it's not natural family planning, that's not natural. Listen, the only time on the whole month that I'm interested in my husband and I could get pregnant, are you kidding? This isn't natural. I'm so frustrated, Dr. Luea. So I've heard these, I'm telling you things I've heard, okay? So I go, yes, that's frustrating. I could see how that would be frustrating. but it is natural because the sense that, I remember when I was a kid in my neighborhood, did anybody have like a mean guy in their neighborhood, like the mean guy, the really bad guy? You know, everybody knows, he's the really mean guy. Some of the stuff you've seen growing up as a kid, you're like, did that really happen? So there's this guy in my neighborhood, his name was Pat, I won't tell you his last name. And he was just mean. He had squinty eyes, he looked like he was mean. And he lived on the other end of the block, so we didn't have to run into him very much. But I remember I was starting to get around the neighborhood on my bicycle with my friend, and I'm riding along, and this little kid's riding on his bike, and bikes were super valuable back then. I mean, you needed a bike, but it was hard to get a good bike, and everyone knew who had the best bikes, right? Who could jump the farthest, everything. My bike was okay. So anyways, this kid was riding along, and Pat sees him, and he picks up a stake, and he goes up to the bike and throws it into the front rim, right through it. And the bike just, you know, bucks him right off. He goes over the handlebars, and he just stands there and just laughs at the guy. That's pretty mean, huh? You don't forget stuff like that. It's a good example, though, of what, so this is wrong. This gets you thinking, oh, that bike was supposed to keep rolling. It wasn't supposed to have a stick in the front tire. And so that is the way I think of birth control pills, okay, for contraception. I think of it that way. I'll probably get in trouble, but that's how I think of it, is like so the pill, it's a hormone combination usually. It can come in different ways, but it has to be stronger than the natural hormones that your brain tells your ovaries to produce. And it has to be maybe 2 to 3 times more potent in order to stop it and make your brain think you're pregnant. So it's a lot like stopping a bicycle. That's the way I think. So that's not as natural as saying, all right, I'm fertile during this time. I can check my mucus or temperature, or I just can tell when I'm ovulating. There's lots of things that actually work. And but I'm just going to respect that time, and I'm not going to change it. I'm not going to try to overwhelm it or dominate it. The word domination is used in medical ethics a lot, that we shouldn't seek to dominate, and that comes from Pope John Paul II, Evangelization. to have technology dominate the humanity of a person. So anyways, NFP is natural because you are infertile at different times, and abstinence, even, this is something I'm going to rip off somebody, said even Wilt Chamberlain was abstinent most of his life. So it's natural to be abstinent. It's just not natural to be abstinent when your wife is very fertile. But that is a free will decision, and it is natural to order your will and your passions. And I tell you what, the older I get, and the longer I've gone, and so we've used natural family planning in our whole marriage, different times for different things. It's not always been something I was really happy about, okay? But I knew it was the right thing, and I figured if you do the right thing, it'll bear the right fruit. And I sort of developed a gut reaction to it over time. You know, like I think a lot of us have a gut reaction to abortion. It's awful. But we might not have a gut reaction to other things that we should. You know, and that's just part of the way it goes. I think when we go to heaven, we'll probably have the right gut reaction to the right things. But right now, we can't really trust our gut reaction all the time. So anyways, about that last one is, I'm sure you've heard this one, and maybe you've said it. I don't want any treatments if I don't have any quality of life. You know? So that's a really big thing. Move on to the next page. I think we got other ones like that. So the top one, I've heard this from some grandparents. I have a gut reaction to this kind of thing. I'm so glad they had a child. They were doing everything right. They're the perfect people, and then they went through in vitro fertilization and they had a child. I'm so happy for them. So I've heard it from some Catholic people, and it's kind of like, I don't know what to say, because I'm really happy that they have a child. I really am. I'm genuinely happy. They probably are going to be great parents. But, you know, in vitro fertilization, the church teaches that conception outside of the marital act, husband and wife, and conceived inside of the mother, which is one they seem to never flex on, that conception inside of the mother it's not considered okay. And so one of the things about natural moral law, this is what I think of. Natural moral law, there's all kinds of things about it, but the way I think about it is, and I see it every day in medicine, it's like if you do bad things, okay, so theology, eternal life, you know, are you saved? Are you going to heaven? That's a different thing. If you're in mortal sin and you die, you go to hell, you know, and there's other, but I'm talking about if you mortal sin or do any sin on this earth, is there a consequence now? And I'd say that's what natural moral law is. You have a bad consequence in this time, in this life as well. Maybe eternally, but for now, something bad can happen to you if you break the natural moral law. Like if you sort of get carried away with your thoughts when you're young. I remember thinking, if I could go through that mirror, I could be in that other house. Wouldn't that be interesting? Now, I never tried to jump through the mirror, okay? Because I would have fallen down and broken a bunch of things. So that's kind of like natural moral law. Like, I knew better. Or a person who is a little crazy and they step outside of a window and they say, I'm not going to, gravity doesn't apply to me. They step out of the second floor and they break both legs. So that's kind of how I think about natural moral law. It's like, it's not an option really. It's just the way it is. And so it'd be good to know what the rules are so that if you follow them, you will be blessed or you'll have good things. And if you don't, you're going to get hurt. So think about some of the complex issues we have now that we have frozen embryos. You know, I know people that have done this. They show you a child, and then they say, and we've got 5 more tries waiting in a vault somewhere. 5 more tries. So what do we do with those frozen embryos? So it doesn't surprise me, is what I say, when you do something against the natural moral law, that you have another dilemma, that you have another problem. So there isn't any real definitive teaching in the church. But I read up on it recently because I was like, it's an ongoing debate with me and some other people. It says the magisterium hasn't made a statement yet, but you can't destroy them because they're people. You know, you can't just thaw them out, mercy killing. It's euthanasia. Isn't that funny how we did something funny and we got right back to euthanasia? Beginning of life, end of life, boom. So thawing them out, it sounds like that would be merciful, but euthanasia, not okay. So what about using them? using them for, stem cells, embryonic stem cells. Well, I think you guys know that it would be, if you take cells out of one of these embryos, it's just like taking the heart out of a person. Because the best cells are the core cells, and they're integral to the life of the embryo. So this principle of totality. So yeah, we can use these principles. It helps you figure it out. Why is that wrong? Because there's a reason. There's a principle. So what about prenatal adoption? I know lots of people that are keen on that. They're like, how about we have these implanted in us? So it looks kind of funny because it's not okay to do that in a normal marriage. Kind of like a rape victim. How can you use the pill in a rape victim and that's okay, even though you're using it to contracept in the rape, But, the church hasn't definitively said. I mean, personally, that sounds like a good idea to me, but, that hasn't been clear. And maybe Ed has some more updates on that. But you have these dilemmas because you got off track in the first place, and they're not easy. This one, maybe the father can talk about this. I've had people that, in all sincerity, they were overwhelmed, they had a lot of children, and they didn't want to use birth control. They thought that was bad. Besides, it's an abortifacient, if you didn't know, in many cases. We can talk about that some other time, but it is. It also causes, well, that's my last slide. So the person went, and then they were told, you've done your job. You've done a good job. You can get your tubes tied. You can get your vasectomy. And maybe they heard that, according to them, from authority in the church. So I hope that doesn't happen that much, because the teaching doesn't say that. And I think we should be very sympathetic, and supportive. And it is, I feel like, Jesus, he chastised the Pharisees a lot. One of the ones that sticks out to me as a doctor is, woe to you who tie these burdens on these people, and you won't lift a finger to help them. You won't lift a finger to help them. This is not easy to say everybody should be not using birth control. They should use natural family planning. They should be open to life, except for serious reasons. They shouldn't do, because our society does these things and seemingly, I guess the simplest way, get away with it or do okay. So I understand what we're doing, and I'm sympathetic. So we need to, as Catholics, if we need to help to get the information out there and support people and teach them good ways of natural family planning. And be sympathetic to people that have done things and have them talk to the priest about that, Father Steve. I get this one. I'm not going to go into this, but this one surprised me. One of the hardest things I've ever had to deal with in my practice. His wife died, or they had a divorce or something. It's like, I'm out there, I'm on a dating service, and I've met the girl, and I can't get erections anymore. So can you help me out? And we've had a great relationship. I knew their wife. This was like, I don't know what their Christian background, I don't know what their background is. I'm like, well, let me be, I usually say there's only a couple things in my practice that I don't think I can do because of my Catholic background. And this is one of them. I don't prescribe these kind of medicines. They call it ED, or erectile dysfunction. But it only needs to function in the context of a marriage, So I said, but I don't want to get into it and be a theologian. You have to find somebody else. So that's my take on it. I haven't read this anywhere. Probably some people would take me to task. But if I'm not comfortable giving birth control, then why would I be comfortable trying to help somebody fornicate? I like to use the words, because they have more power. Fornication doesn't sound good. One patient, he came back to me and he said, I thank you because I was about to be unfaithful to my wife, is what he said, because she had passed away. So infidelity is another way of looking at it. The last two, masturbation. Oh my gosh, this has gotten so many people into trouble. It's not being clear that masturbation is morally wrong, okay, in the Catholic Church. I just wanted to make that clear, that's all. So, that gets in so much trouble. Really what it does is most of the time masturbation, the person is experiencing the sexual excitement and arousal and completion in the absence of the person. And so this just leads to the depersonalization, the dehumanization, and the disrespect for people. That's the problem, is you develop this whole recreational event separate from the right object, which is, it's supposed to be babies and bonding, okay? And now we got everywhere you go, Cosmo, how to help your relationship by getting into pornography. I mean, come on, does anybody really think pornography is going to help? Well, maybe they do, but they shouldn't. Okay. All right, so then the last two have to do, it's kind of funny, I just juxtaposed them because of the modern thing about gay marriage, or you can marry other people, it's a legitimate marriage. And then the bottom one is more what I see is lots of couples that don't get married. They don't get married. And some of them are very faithful to each other. Maybe it was like common law marriage almost, 4 children, we've been together. But also teenagers, I mean, this is unbelievable with Instagram and all the text messaging and sexting. I mean, it's out of the bag. They are, when I was in middle school, there were people who bragged that they had done sexual things. There were people that had used marijuana. There were people and they were the kind of the cool people, the risk takers. That just tells you what kind of social pressure was there that wasn't healthy. But now, I mean, I'm sure there's still kids that don't, but it's pretty standard. If you really love somebody and really attracted to them, you can have sex with them. And we've walked over that, and we can't give up the ground on that. We have to be consistent. Like, no, it's not okay. And I try to counsel people that way, in a way that they can receive it, because you have a relationship with them. You don't want to scare them away. Everyone else is going to tell them. Then the other one, you should be able to marry as long as you love them. You can see where that can get you into trouble. I read about a guy in Germany who wanted to marry his dog. So I'm not going to give you any more details. Right. Next slide. Legally, he wanted to marry his dog. So this is another, cover your ears if you don't like this stuff. Sex acts are fine as long as they're with my wife, Well, that comes out of the 60s. They're fine as long as they lead to marital intercourse where there's a chance for babies and bonding. So that means vaginal intercourse, But, I mean, we got 50 shades of whatever out there, and people are getting all fired up. This isn't going to help them to be happy. You can't get around the natural moral law. So the church should encourage birth control, since it would prevent abortions. You ever heard that one? I mean, I see the logic, right? There's a lot of unwanted pregnancies, unintended pregnancies, and then when they get pregnant, they still don't want the pregnancy. So if they were able to cut it off before it started, then most people admit that abortion is regrettable. Like a lot of Americans agree that they won't agree that abortion shouldn't be legal because they don't want to tell another person, kind of a libertarian approach, but they still don't like the idea of abortion, And thanks to the pro-life movement, really. So, but Humani Vitae said this doesn't work. And I think over time it hasn't borne out to be true that it prevents abortion. Because the problem is, it's actually the contraceptive mentality. So the contraceptive mentality says, when I get pregnant, something goes wrong. Something went wrong. My objective was to not get pregnant. I'm on birth control. Something went wrong. And I always tell patients, and I think I totally got this from Phil Fleming, Dr. Phil Fleming. No, actually, when you get pregnant, something went right. Something went right. It's that bicycle riding down the road without a stick in its front spoke. The reason that we're all here is because something went right. Something went right many, 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 many times since the beginning of time. And so that is not that's the contraceptive mentality. And if something went wrong and I should have stopped it, then abortion is the logical conclusion. I talked about the next one. This is my last slide if you want to know. Oh, I've gotten this one too. I don't want to get vaccines since they're made from aborted babies. The only reason I brought this up is because the church does have an official teaching on this. So I don't know. There's lots of controversy around vaccines right now. I'm not taking on all the controversies because they don't all pertain to the Catholic teaching. But this one in particular, a number of vaccines, for example, the MMR has rubella in it. These are live viral vaccines. Varicella, the shingles vaccine for adults, not the new one, Shingrix, which is coming out. That one does not use aborted tissue, and it's much more effective. But the one that we give for children, varicella, Varivax, to prevent chicken pox. Gardasil, which is to prevent HPV virus. Let's see, hepatitis A, might be missing one. But anyways, there's several vaccines that are considered good or helpful, but they use immortalized stem cells to culture these, human tissue culture. And it's widely accepted that they were originally from some type of aborted fetus, And it's difficult to get disclosure from drug companies about whether they were aborted or where they were taken from a miscarriage and donated, but they usually won't do it. So it's widely accepted that they do use aborted tissue. They're not killing a baby. They've immortalized the stem cells. They culture them at one stage or another of developing the vaccine, and then they give it to you in the form that you get in the office, or nowadays, Rite Aid, right? So there are many Catholics of conscience, and there's other Christian, separated brethren Christians of conscience who say, I feel like that is material cooperation with evil, because I'm giving them money. And so right now, Ed probably knows on the status of any more stem cell lines being made legal or not, but that was the whole George W. thing where he was like, we can't have any new ones or something like that. The church says that it's regrettable, but we are not taking the direct life of these babies. And if there's a concept called the common good, and in the common good, and also to protect your child, that you should get vaccines, but you should also ask them, write these companies and say, hey, give me a better option. Give me a better option. So that's the official church's teaching, is that you actually can get those without violating your conscience. I can hit the last two quick. An IUD doesn't cause abortions. IUDs become really popular, from my observation. It's an intrauterine device. It usually is some type of a plastic or a metallic T-shaped device with hormones now in it, usually progestin, which is artificial progesterone, placed into the uterus. And, did I go backwards somehow? That was nifty. And so it goes in there. You guys probably remember like the Dalcon shield. Remember hearing that? That was copper IUD, and it would get into the wall of the uterus and it caused some problems, lawsuits. So they took that off the market. Well, quietly they came back with Marina as kind of the top one now. And there's a lot of good people I know that they didn't want to use birth control for lots of reasons. But then their OB-GYN told them, let's use this IUD. So they don't. And I've asked them, so how did they say that works? It shows up on their med list. I don't want to harass them. I'm just asking. They said, well, it says that it keeps the mucus in my cervix from letting sperm in, and so I don't get pregnant. And I said, did they tell you what it also can do? And it disrupts the lining of your uterus so that if you get pregnant, here's the definition is important. When are you pregnant? It's not when it implants, right? And you get the positive urine pregnancy tests, which are very good. It's when the egg and the sperm get together and you got a new human being coming down the tube. They come down the tube, they're almost there into the little cradle, soft lining of the uterus. Come on in here, darling. And there's this Transformer Decepticon guy in there. They are not ready to handle that. So they just pass right out of the uterus. You don't even know you were ever conceived a child. So it prevents implantation. I mean, there are the hormones can help the cervical mucus thicken, like the body naturally does after you ovulate. The progesterone goes up, thickens the cervical. So there is some degree of that. We don't know. But that one really, I think you gotta say, it's an abortifacient. And that would cause direct abortion, which is never morally listed. The last one, a good internal medicine doctor, Chris Kallenborn, many years ago. He's kind of a guy that seems like he might be on the spectrum. I love the guy, but not real relatable, you know. And he dropped his internal medicine career and started writing books about birth control causing breast cancer. Now, I mean, as a society, breast cancer is like awareness is everywhere. I mean, pink socks, pink gloves. Everybody knows somebody that had breast cancer. When I was in medical school, I'm a guy, I'll admit it. I was like guy-centric. You know, so I remember sitting in a lecture hall like this, lots of hours of those. I remember they were just throwing out stats on breast cancer, prostate cancer. I think I got the prostate cancer one. I didn't really get all the breast cancer. So then 3 years later, maybe 2 years, it's 3 years later, and they say, yes, 1 in 8 women will have a lifetime expectancy of getting breast cancer. And I looked to one of my female colleagues next to me and I said, now, hold on just a minute. I wasn't paying as much attention as I am now to this, but when our first year, didn't they say it was 1 in 12 lifetime? She goes, yep. So what changed it? What made it so common? So Chris Kallenborn came out and said, the Oxford study, which was this big meta-analysis, which they try to take all kinds of information, put it together, and then make a statement, said that it's not linked to breast cancer. The birth control pill is not linked to breast cancer. And that was the final statement for many, many, many years. Well, I always told my patients that hormones can cause breast cancer. And there's a lot more that could be said, but I think it was a month or two ago, and one of my things I didn't do before I came here that I wanted to, I read the New England Journal of Medicine, and finally they had a mainstream article that says, well, of course it causes breast cancer. Of course, everybody knew, like as if. Especially in what Chris Kallenborn had said, they weighted the evidence poorly because the first birth control pills were mostly estrogen, but it's actually the newer, higher progesterone or progestin. Even though they're in micrograms instead of milligrams, they're so much more potent that those are the ones that are causing twofold increase in breast cancer, especially in women that start them before they've had a baby, and especially in women who've had an abortion, and especially in women who have not been able to nurse their babies. So it just seemed like hormones are very connected. And then between that talk from Chris Kallenborn and now, where we finally have a major journal saying, yes, oh, yeah, it does, but it's not that big of a deal. I mean, really. I mean, come on. I mean, that's how the article went. I was kind of stunned. But I'm going to read it several times to make sure I really understand everything. But in between that, we had the women's health study, and that was all about hormone replacement causing breast cancer. So the pills that we used for hormone replacement, like let's take the most common one, Prempro. It's really common. Premarin. Those are artificial estrogen, different forms, estrase, plant form, Premarin, horse urine, pregnant horse urine, purified. Those are about, I always say they're about a third lower, 1/3 of what, and nowadays we use even half of that. So there may be like an 1/8 as strong as the typical oral contraceptive pill, and it's made out of the same hormones. Same hormones. And yet the entire world ran like it was like a house was on fire. The doctors and all the OB-GYNs, maybe not the family docs as much, because I think we balance stuff. We try to balance some of that out, not that we're any better, but we sort of look at a bigger picture sometimes. But I had doctors who were OB-GYNs when I trained, and they were like, every woman should be on hormone replacement therapy. This is the fountain of life. This is the best thing that ever happened to women. And they were very sincere, but a little psycho, a little, made me a little nervous. I'm just learning. So when I read about it, it looked to me like there could be some risks of heart attacks, strokes, and breast cancer when I read the same data back, 20 years ago. And so anyways, the women's health study came out, and the whole culture of OB-GYN rejected hormone replacement therapy only for certain really specific exceptions because it could cause breast cancer. I think it was like 10 cases in 200,000 or something like that. It was a very small number. It also could do heart attacks and strokes. But they stopped they wouldn't look back and say, well, what about all these other hormones that we give them? I mean, they're 3 or 4 times stronger. And yet we counsel people for acne, put them on it for acne. So let me run 2 principles from the original Hippocratic Oath, right? Beneficence. So let's take the secular ones. Autonomy, beneficence, non-maleficence. You get somebody and you're going to put them on the pill. By the way, I don't put them on it for birth control, but I have used it for other things that regulate, and that's okay. You can do things. It's not evil. You just have to use it for the intention and do the double effect and all that. But anyways, you need to tell them that there's risks involved with this. Now there's better data, but the whole world is excited about trying to prevent breast cancer and raise awareness, but they won't talk about it. Unfortunately, I think it's because it's tied to women's independence, and so I respect women's independence, no doubt about it. But natural moral law, you do something that's not okay, bad things happen. You throw a missile in the front tire of a bicycle, it's going to wipe out. So anyways, I'm not excited about it. I'm saying it kind of dramatically and strong just so it kind of stays with you, because you might not hear it from too many other people. I think is at the end of those kind of slides. So there's a lot of things. I hope that there was something in it for each one of you tonight. I hope that you were challenged, but I also hope that you were reassured. Whenever I read things in the church teaching, there's other things I could say, but I think about this stuff all the time. And it just always makes sense that God loves us. Sometimes it's hard. I mean, sometimes you find yourself like back in your house as a little kid when your parents said, you can't do that. You just can't do that. It's not. And then you got older and they said, here's why. Here's what I want for you. And here's why. And then they say, when you go out there, don't forget you're a Luea. You're a Luea. When you represent yourself, you're a Luea. So that's kind of the last stage of morality, I guess. You're Catholic. You're a Catholic. You're a Christian. And scandal, let me say this one. The definition I like for scandal is when your actions lead others to sin. Okay? So you may have the right intent, but it's important to it does matter what you do. We're not individualistic. And then we also, communion of saints. I mean, if we sin, we hurt the rest of the body of the church too. So I just wanted to show you something at the end here. I found it inspiring. Never heard of this fella. My wife is always looking up good stuff for me. She got me I think you got it, or did Madeline get it? Madeline, okay. So anyways, this is a video I watched this week. Somebody was prompted by the Spirit, you should watch that. And I did. I was moved to tears. This is a man, he's a physician. He was much more significant in the world than I have been, at least on the... He's a French physician. He passed away of cancer. And he's a modern person. And he is the man he's a pediatrician who got into research in France. And he discovered the genetic basis for Down syndrome. And so he's a really good scientist. And he was recognized internationally. He was an international speaker. He's a charming individual. He's really smart. But it came out that he was a really devout Catholic. And he had a clinic where he took care of Down syndrome children. And up to then, they were pretty much treated as less than human, thought of as less than human. Anyways, at a certain point, he saw that they were starting, after abortion was legalized in the US and some other places, he saw that people were using this information to do prenatal diagnosis. And I mean, to date, I think if you do a prenatal diagnosis of Down syndrome, about 90% of those children are aborted. And the medical community recommends that. Not me, but I mean, I know, I've heard this. I've heard this years ago, I heard it now. Not everybody. So there's pressure to say it's not a person. And, get this taken care of. So he found himself in a situation where his discovery was causing the demise of the children that he loved. So he ended up giving a presentation that basically knocked him out of the running for just about every award, because he said, "Are we going to be the National Institute of Death, or the National Institute of Health? We're not. I'm a physician. I don't kill." So this was a statement of his, and he ended up fighting against the legalization of abortion in France and did a good job, but eventually it did become legal. But after I watched it, I was really inspired because, sometimes you can say, "Oh, my life's kind of hard, I got to do," which I'm not saying. I've been very blessed with good partners and good people that support me, good everybody. I haven't really been given a hard time for trying to follow these things. I haven't had to risk my entire career to date. And we can approach these things like, I want to make sure I do the right thing, anything wrong. Same with, like, let's say family planning, like, yeah, we should, let's be good about it, but let's not. Or you can try to be heroic. You could try to be heroic, So heroic people stand out sometimes, people that make a stand. So he threw it all away, but I'm sure that his reward is great. He had some good statements. You've probably read them already. Contraception is to make love without a child, separating babies from bonding. Artificial fertilization to make a child without making love. Abortion is to unmake the child. Pornography is to unmake love. And all of these, to varying degrees, are incompatible with natural law. I would encourage you, if you're interested, look into that. I actually have the trailer for his movie. It's a 2-minute trailer there. I thought it was kind of cool video.
I don't know if we got audio. I don't know.
Oh, we don't? Maybe.
I'm not sure.
We should. Well, where's Brian? He can. But anyways, a couple things I just put at the end here, and we can run that if you want. Humani Vitae. This is the 50th anniversary. If you've never read it, go to the Vatican website, look under Pope Paul VI, read a copy. It's kind of heady, but not too bad. One of the things about it that has changed, it said that if we allow the church to authorize, to change, basically the church was being asked to say, maybe having access to effective contraception, they were talking about the pill, would really help marriages, because right now they're scared about having too many kids, and we're poor, and there's all kinds of really good reasons. And basically the church said, we get the point, but it's not up to us. Like, we don't make the rules here. And it's been a document that's been ignored by a lot of people. And one of the things it said is if we do this, there's going to be widespread lowering of human morality, okay? And that there's going to be more infidelity in marriages and relationships. And do you know the divorce rate skyrocketed after this, skyrocketed. And also that the man wouldn't respect the woman as a person. He would just want her as a sex object. And that obviously the ultimate is like where you have pornography, And so now, even in the secular world, we have this pushback because men have really overstepped their bounds, taken advantage of women, positions of power. Nothing new under the sun. What was the reading today? Anybody read it? King David, and he took the lamb of the poor man. Yeah. Take a reading of that. So it's nothing new under the sun. It's a protection to know that your gun is loaded, okay? That's what Janet Smith would say. If you can get people pregnant, you'll think about it. What am I going to do? Some of the people in this room, just something real quick. Proposal B, you remember that? That came out a long time ago. The bishops got that right. So the end of life issues, durable power of attorney. The church promotes durable power of attorney. There's a lot of things like living will. A living will, it can violate autonomy, because when you can't speak for yourself, you've already wrote it on paper, things could have changed. So make sure you have a durable power of attorney, and take a look if you've got something tied to your will or something make sure it's up to date and then it's consistent with what the ethics are. But best thing would be to have somebody that you know that can speak for you sit down. My dad said, I want you to be durable medical attorney for me. And I was like, okay, why don't you come over? 2.5 hours later, I said, well, that's probably enough. So there's a lot of situations that can come up and you don't know. So I'd encourage you, that's a good move. Maybe, Brian, you can put some kind of link, if you haven't already, to the National Catholic Bioethics Center. They don't mind lay people checking on their information. And then if you're healthcare provider, worker, look up the Catholic Medical Association, get tied in. We talk about things like this all the time. All right? Thanks.